This is reflection 4, the final reflection of the quarter prior to our final paper. In this reflection, we were instructed to look at the function of supervision, the relationship really between the supervisor and the supervisee, to look at any assumed challenges and benefits involved in supervision as it relates to ethics, to also provide 3 examples of situations that would require consultation with a supervisor, and to just discuss how the supervisor and the supervisee might work to resolve each situation. To begin, I'd like to just mention the main goals of supervision that was described in the Corey text. The first one of these is to promote the welfare of clients. The second is to promote supervisee growth and development. The third is to monitor supervisee performance and to serve as a gatekeeper for the profession. And the fourth one is to empower the supervisee to self-supervise and carry out these goals as an independent professional. In the next part of the Corey text, it describes what the American Mental Health Counselors Association notes when it talks about the commitment to clinical supervision. Within the text, it states, clinical supervision is an important part of the mental health treatment process. This purpose is twofold: to assist the supervisee in providing the best treatment possible to counseling clients through guidance and direction by the supervisor regarding clinical, ethical, and legal issues, and to provide training to the supervisee, which is an integral part of the counselor education. Supervision is also a gatekeeping process to ensure safety to the client, the profession, and to the supervisee. So drawing on the next part of this, I'd like to look at the informed consent and supervision. So I'm going to pull from both the ACA Code of Ethics, and then also talk about what the New Mexico Counseling Guidelines for Ethics also touches on. To begin, mentioning client welfare in F1A. In the ACA Code of Ethics, it states, a primary obligation of counseling supervisors is to monitor the services provided by supervisees. Counseling supervisors monitor client welfare and supervisee performance and professional development. To fulfill these obligations, supervisors meet regularly with supervisees to review supervisees' work and to help them become prepared to serve a range of diverse clients. Supervisees have a responsibility to understand and to follow the ACA Code of Ethics. Now, within the New Mexico Counseling Code of Ethics, it was very minimal in terms of any reference to the process of supervision, but it did note that we do have the responsibility to clients to let them know that we need to make sure that they're aware of our supervisor, that we are undergoing supervision, and they need to have the license and the name and qualifications of the supervisor so that they have that information. Also within the ACA Code of Ethics, it talks about the limits of confidentiality. This is when it mentions the disclosure that you are under supervision to the client. In section F1C, it states informed consent and client rights. Supervisors make supervisees aware of client rights, including the protection of client privacy and confidentiality in the counseling relationship. Supervisees provide clients with professional disclosure information and inform them of how supervision processes influence the limits of confidentiality. Supervisees make clients aware of who will have access to records of the counseling relationship and how these records will be stored, transmitted, or otherwise reviewed. Also within section F5C, it states professional disclosure before providing counseling services. Students and supervisees disclose their status as supervisees and explain how the status affects the limits of confidentiality. Supervisors ensure that clients are aware of the services rendered and the qualifications of students and supervisees rendering those services. Students and supervisees obtain client permission before they use any information concerning the counseling relationship in the training process. So with all of this, it's really just making sure that the client is aware that you're undergoing supervision, what that means for their own confidentiality. And along with this, in terms of the informed consent, it does note that not only should there be an informed consent from the supervisee to the client, but there also should be from the supervisor to the supervisee an element of informed consent. because of just making sure that the supervisee is aware of what the relationship between the supervisor entails and what their responsibilities are. So there were some different roles and responsibilities of the supervisee when it comes to being an active participant in the relationship with their supervisor. Some were just making sure you're being collaborative, owning the power that you have as a trainee and learner, making sure that you ask for feedback on both your strengths and areas where you need to improve and be open to that feedback. Also making sure that, giving feedback to your supervisor about what you feel helpful or unhelpful in the dynamic. And then also it mentions paying attention to the sources of countertransference and where those are coming from. So with this, it just made me think of, my role in the workplace with the supervisor I have now, and the layers of that transference and countertransference that could come up. I had, when I was growing up, it was very common for my papers to be read aloud to me and just said this wasn't right, this wasn't done well. And I remember feeling really insecure and sad, and there's just a lot of history with that where I just felt overly critical of myself. So with my supervisor now, there was a moment when she was going over this document that I was going to submit, and was doing it similarly to what was done in my childhood, and I just felt a lot of heightened emotions, feelings in my throat, kind of just feeling really stuck with my voice with this. And I think changing that and kind of talking through my own feelings of discomfort with that type of feedback would be really helpful. So it would be for myself to get past this needing to please and needing to just go along with what the supervisor is giving to me, but requesting different types of feedback and saying, maybe this isn't working for me for this and this reason, or just maybe taking my own time to note the differences in this isn't what was happening when I was younger. It's just me needing to be more open to the feedback and not taking it as more of a personal attack on my own worth or well-being. So, continuing with this, what I really liked about what was said in the Corey text was talking about, as the supervisor, to not place your own voice onto your supervisee, not giving them the words, but really drawing into what are their words and what's their voice and how would they handle the situation with the client, but also providing, necessary feedback, right? So I liked how they brought up questions, right? They mentioned, what direction do you think is the most appropriate to take with your clients? How do you, are you feeling free enough to bring these and bring, your own questions? How comfortable are you to try to really build up their own personal approach, and to really help them hone in on their strength areas, things to improve on, but allowing for their own voice to come forward. Now, I think what would be challenging with this is the liability that comes with being a supervisor. It was mentioned that often the supervisor will take a hit if there's an issue that comes up. Say the client, reaches a place where they self-harm or take their own life, things like that. That liability and those things would fall onto the supervisor, and different legal things, different ramifications. So I think what would be difficult is working with your supervisee to find their own voice, but also making sure that they're not taking steps that would warrant a cause for concern and a cause for various legal actions to come back onto you as a supervisee. So it's just probably trying to figure out a balance and really leaning into assessments or feedback to make sure that what is being done in session is something that would not cause harm to the client and would not bring about a legal issue to yourself as the supervisor, to just make sure you're leaning into that protection. There also was, there was a discussion on multiple roles, and that could be grounds for concern, right? So I think, when I was thinking of supervision, my first thought was, my own therapist, and how I think I really valued her role in my life and just the way she approaches things. And there was a little light bulb that thought, wait, maybe that could be someone that I could lean into. But there's really this need to make sure that there's not a blended relational dynamic because of the concern of bias, not being neutral, not being able to supply feedback in a way that's objective. You want to make sure there's the dynamic of maintaining objectivity. So there really is only that one role, supervisor and supervisee, which makes sense, right? So that's really just kind of the background I wanted to lean into. The other piece of this, though, would just calling awareness to that supervisor contract, which I think is really a useful tool to make sure that both parties involved are understanding the roles. It's something that's signed so that everybody's aware of what's going on. The last thing I want to talk about is competence of the supervisor, just to make sure that it's noted that it's really unethical for supervisors to be giving guidance or advice that's outside of their area of expertise, and knowing and having the ability to recognize that through self-reflection, self-monitoring, to make sure that there isn't this I'm going to be giving advice on something where I'm not qualified to be giving advice on. So with that, I'm going to transition over to the examples that I wanted to look at. The first one is relating to a situation of possibly there being some spiritual differences between the client and the supervisee, or the supervisee and the supervisor, and trying to figure out how do you navigate those situations. For example, say you found a supervisor who is operating out of a treatment center that has a spiritual backing, one where it's very heavy with influences of Christianity, things like that. How do you go into that relationship with respecting the needs of the client, but also not pulling in different biases from that sense of spirituality, and maintaining that role of respecting the client's spiritual beliefs. So say a client comes in, not being aware that this particular counseling center is backed by that of a Christian church, right? They go in, they're seeking, treatment. How do you go about that? And, I think it's mainly just trying to navigate what is being said in the informed consent document to that client, making sure that they're aware that this particular, treatment center is going to be one that is backed by different spiritual influences and such. So that could be a situation where, what if the client is not comfortable with that? What if it comes, you're in the middle of a couple sessions, they bring up that, their belief is completely contradictory to what that institution has. What if the supervisor comes back with, you need to make sure that you're pushing this belief to the client, if it's something that's kind of more of a private sector, and then you're kind of placed in this middle ground of protecting the client's well-being and also being pushed from this stance from that supervisor. I think from my own perspective, if I was a supervisee in that situation, I would really work on making sure I have case notes, talking to the supervisor of not wanting to cause harm to the client, and wanting to understand where's the line between pushing beliefs to them that they don't that doesn't fit them, and maybe there might be a need to send them to a different a different treatment center. Maybe this isn't the one that they need. Or maybe for myself, in terms of supervision, the lack of bias in that dynamic is not something I can get on board with, or the bias in that situation, and trying to push a need towards a client. Now, say, moving on to some different components would be the concern for transference in some different situations that may come up, right? So I think in the Corey text, it talks about the relationship ending of a supervisee from a long-term standpoint. And if they're a relationship counselor, a couples counselor, what would that do to their ability to maintain an unbiased stance with their clients, right? And making sure that there's still a source of neutral grounds and not putting their own frustrations and feelings of sadness, anger, whatever's coming up for them onto those clients, and ensuring that they offer them the most reliable support that they can have. So if I was the supervisee in that situation, I would make sure my notes are really sound, making sure that I'm making a conscious effort to note when I'm feeling triggered, and to see maybe there's a need to, to try to figure out how to self-regulate and bring up this to my supervisor and kind of explain, this is what's going on for me. I do want to be a source of help and healing towards the clients in my care, but I'm noticing that I'm sitting with this frustration that's coming up, and offer some guidance. And, as the supervisor, throwing out some different things of, what do you think would be helpful in terms of staying grounded? How can you note the different areas that have been triggering you, and possibly, seek external treatment? Make sure that you're getting your own counseling to work on these different trigger elements, and making sure when those come up to work on possibly taking a breath, making sure you're being grounded, holding that space of neutrality. And how do we make sure that there's techniques that are going to work and help support you as a supervisee as you continue to treat the clients in your care. Another element of bias that I think kind of hit pretty close to home for myself was, there was the situation where I was talking about the mother being diagnosed with cancer, as whether terminal or not. It could cause some overwhelming feelings upon seeing clients, especially if they were clients that are experiencing similar issues. And how do you continue to uphold that space of safety and neutrality and support when you yourself are experiencing a lot of heavy feelings? So with that, I think about myself, watching my grandma pass away from cancer, and how it did. I know that around the rawness of that, it may have not been the best time for me to be seeing clients. I think maybe there could be a question of, is there a sabbatical needed? Is there some time to make sure that you're gathering tools for healing, and then coming back to offer treatment to those that you are aiming to help? Because I think that there's your own healing and grief that's going to come up, that you may just need that time to process and to heal. So that I think is something that could be brought up between the supervisor and the supervisee. Or maybe it's something where maybe there's some self-disclosure. I don't know if, kind of balancing that, but how do you go into that relationship, hold the space for your client without burdening them on your burden, but kind of seeing that processing happen together, and if that's something that could be beneficial, right? We're not overwhelming them with your issues, but offering empathy because you're going through something that's really similar to theirs. And I don't know if that would be more harmful or helpful, but just talking through that and figuring out what is the best next step, keeping in mind the most important person in the space is the client. So to conclude all of those, to wrap up this reflection, I really think it's important to note the importance of informed consent, not only for the client, but also for the relationship between the supervisor and the supervisee, making sure that all of those items get disclosed. In terms of the next piece to this would be making sure to uphold that confidentiality, in the sense of letting the client know that you are currently undergoing supervision and what all that means, and that can be a part of that informed consent. Also, I think competence is a really big one, to make sure that to know not only your limits as a supervisee, but also making sure as a supervisor to know when there's a point where this is now no longer something that you can offer effective guidance on, and to know how to address that when that occurs. Also, I think it's really important to being receptive of feedback, not only as a supervisor, but as a supervisee, to adapting to each individual's unique needs, and to figure out how to make sure the dynamic is the most successful as it can be. The last thing I want to conclude with is just making sure that as a supervisor, you're aiding the supervisee to find their own voice. Instead of telling a supervisor, there's a quote on page 353 of the Cori text where it says, instead of telling a supervisor telling supervisees what to do, the supervisor can help the supervisees think about their clients in new ways, formulate their own interpretation, and devise their own interventions. And I really think that's the key in making sure that we're bringing up, as a supervisor, to have supervisees be the most effective they can be by helping them find their own unique voice and offering support to those in their care.